Yes, welcome everyone. Today we're gonna have a short session. As you can hear, my voice is not really okay. So the short session of today, we will deal with something called ulcerative colitis. Ulcerative colitis. Uh, Yesterday we dealt with the irritable bowel syndrome, and you saw it's irritable bowel syndrome. Mostly, it talked about nerves. It talked about nerves and the relationship between your brain, okay, uh, the relationship between your brain and the gut. And we said the gut is inclusive of every organ, like intestines, the large intestines, the small intestines, the stomach. That is about the gut. So, when we're talking about irritable bowel syndrome, I'm just going through a recap of what we talked yesterday. When we talk about irritable bowel syndrome, we are talking about something that is related between your mind and yes. Okay, I'm trying to send some links here. Trying to send some links. Hi, Margaret in Norway. We are continuing with gastric issues. Welcome to the platform. About yesterday, we talked about irritable bowel syndrome. I've got some questions which I've been answering. And irritable bowel syndrome, most we talked and we said the relationship is between the brain, the nerves, and the brain, the nerves, and the gut. Welcome, Margaret in Norway. I can see you. Hi. I'm just starting. Now, we're going to have a very short session today. As you can see, as you can hear, my voice is down a bit, and I'll try my best to do what I can. So, if you've been having something called irritable bowel syndrome, just know 75% to 80% of the cases we see in irritable Barbara's I made it early today. Welcome, Barbara. 75% we saw to 80% of the cases that we have of irritable bowel syndrome is the mind and the gut. And we saw most of them, thanks, Margaret in Norway. And we saw that when you want someone to be okay, I'm going through what we did yesterday. When a person is diagnosed with irritable bowel syndrome, it is a question of months and weeks, at least 3 months, 3 months to 6 months, being diagnosed with diarrhea. Hi, Mumbwa, welcome. Being diagnosed with diarrhea that is not related to any pathogen, a diarrhea that is not related to any pathogen. So when you have someone who has been going to hospital always, and this person is not diagnosed with any pathogen, like say, guys, remember to put a like, remember to put a like, and let's interact and share your links also. Share your links so that if someone new comes in and is not subscribed to your channel, you can follow the link. Now, I'm going through what we did yesterday. If someone goes to hospital and this person is there is not diagnosed, he has done blood works, he has done stool tests, and the tests are coming negative of everything. And it's been welcome Jamaican uncle, welcome. And you've seen that this person, please, as you come, don't forget to put a like. You know, likes increase impressions. And if you have also a channel and you are liking other people's channel, they give you an impression on your channel. So please, as you come in, please give a like and we increase the impressions. Anyone who can share other people's channels here, it's okay. Go on and share. We need people to have a community. Now, I've said about what we talked yesterday. If someone has been going to hospital, not diagnosed with any pathogen like amoeba, typhoid, H. pylori, for a period of 3 months with a diarrhea, then it ends up to 6 months. This one is categorized as irritable bowel syndrome, IBS. And if it is diagnosed with IBS, what happens? You should take care of your nutrition, what you eat, and also you should check about your mental health, because we saw that the most important thing when it comes to IBS is mental health. The most important thing when it comes to IBS is mental health. So please, it is important you check your mental health when you have been having a constipation of at least once a week for the next 3 months. Then it goes up to 6 months. You know you're dealing with IBS, and mostly when you go to hospital, there is nothing that is got. So that one is important. When you know that you have that, know that there is no treatment you can get. The only treatment you can get is mental health and nutrition care, and not eating a lot, eating small food over time, because the stretch in your abdomen leads to pain in your brain. You get it? Because it is nerve related complication. Now, today we are going to study something that is called ulcerative colitis. Ulcerative colitis. This is the chronic inflammation or inflammatory disease, the chronic inflammatory disease of large intestines. When your large intestines are inflamed, characterized by continuous inflammation. Rogers, welcome to the platform. Welcome to the platform, the Rogers. Continuous inflammation of mucosal lining of the colon and rectum. And rectum. So I think it is good. I think it is better that you know where the colon is, the large intestines is. Eh? So when you have, if my voice is down, tell me so that I can raise my voice. I've not had my, I have a stuffy nose. Okay, now inflammation of the mucosal lining of colon and rectum. You see, these are the large intestines. When you are dealing with ulcerative colitis, this is a sister of irritable bowel syndrome, but now this one affects only the colon and the rectum. When we talk about ulcerative, think of an ulcer, and I said an ulcer is something called a wound. So ulcerative colitis is a wound inside the large intestine. Is a wound inside the large intestine. Eh? Colitis, colon. When we talk about colitis, we are talking about the colon, you see. So when I'm talking about ulcerative colitis, think of the colon. Think of the colon. Yes, please. Thanks for those who are liking the video. Let's go on liking and liking and liking. Let's increase impression and have more people coming in as we interact. If you have a question, just ask, please. Just ask the question and we continue with the topic. I'll be slow today, so please understand. Understand. My son is autistic and he has at some point suffered a serious constipation but he is okay now. Barbara's spoiled. What? How old is your son? How old is your son? We would love to know how old, because sometimes children suffer constipation because of some other issues. So it depends with age again, and what age your son was suffering constipation. Yes, let's continue liking and increase impressions. Like the topic. If you have a question or an additive, please just put your word on the chat and let's continue. And those people that have not joined the WhatsApp group, there is a WhatsApp group. When you have a question or you want to interact with our fellow YouTubers who have questions, you ask, you join. Just let me put that number 254 plus 5472 6024. I'm putting the number so that there is a group that we have formed and that helps us to discuss matters away from, welcome J. Kingre, away from the platform. So if you are willing to join it, just text there from Benjamin the Wise Guy and you'll be added to the group. So that is the number. You can check. You can be added to the group if you like. Now, let's continue liking. I can see we are, he is 11 years now. But how is the flu doing? Uncle, the flu is, I'm getting better and better. You can see I'm talking so slowly today, but I'll be better. I'll be better, don't worry. He is 11 years now, but he had a problem at the age 7, 8, and 9. Yes, Barbara's world, as they grow, the problem goes away. With proper nutrition and care, the problem goes away. So don't worry, the boy will grow well and he'll be blessed and he'll be a prominent person one day. Now we continue by I was just introducing what is ulcerative colitis. You see, the continuous inflammation of the mucosal lining of the colon and rectum, the mucosal lining and rectum, resulting in an ulcer. I've said an ulcer is a wound. Yeah? It can bleed and this person can have, welcome Barbar's word, you can have a diarrhea with bleeding. You get it? So ulcerative colitis is just saying inflammation of the colon, the large intestine, forming a wound. In simple language, forming a wound, is one of the most major undergoing in a major condition under inflammatory bowel syndromes and diseases. You see, inflammation normally in your body is body response to helping your body not to be attacked more. But you see this one, ulcerative colitis brings inflammation. So you feel pain every time. You feel pain every time you eat food or the bowel stretches. You know, when you eat food, your bowel, your gut stretches. So when it stretches, you feel some pain because you have wounds in the colon. And I said, when you feel your abdomen is full and bloating, most of the time, whatever that is making the abdomen bigger is not in the stomach. Most of the time, whatever that is making your abdomen bigger is in your large intestines. When you have your stomach having acidity and gas, you feel the burning sensation, but you don't get the fullness. The fullness mostly is in the large intestines. Now we continue and say this: chronic relapse inflammatory disease limited to mucosal colon, begin in the rectum and spread continuous to where the rectum is and goes proximal up to the colon. And this, in simple sense, is it affects the whole of the descending colon from where the colon diverts down to the rectum where you pass stool. And it has some characteristics it has some characteristics. Ulcerative colitis has some characteristics. So when you say that you have ulcers, when people say that they are diagnosed with ulcers, welcome them to us world, welcome to the platform. As we check in, please, if you feel the video and the educative material is good, it's good to give a like and share. So just if you feel it's nice and you are learning something, give a like and share to some other people. Now, when you say that I went to the hospital and I was diagnosed with an ulcer. I have ulcers. It depends with where the ulcerations are. Why? Because sometimes people have duodenal ulcers. Those are small intestines and they present in different ways. El Marie Smith, welcome to the platform, El Marie. Hi, Benel. Greetings. Greetings, El Marie. We are talking about ulcerative colitis. Ulcerative colitis. Yesterday, we talked about IBS, irritable bowel syndrome. So let's welcome El Marie in the platform, guys, and let's continue discussing what disturbs people. Now, when you are diagnosed with ulcers, it depends where the ulcer is. So, if you don't take care of the ulceration correctly, you may end up being worse because ulcers in your stomach, ulcers in your small intestines, the gut, and ulcers in the colon, which we are calling ulcerative colitis, they are treated totally different. They are treated different. So the topic of today is ulcerative colitis, and ulcerative colitis, we have said, is wounds. These are wounds in the Botswan. Well, thanks a lot for your work. Continue doing it. This is wounds that are in the colon, the large intestines. Just before you do what? You pass your stool. You pass your stool. Now, the characteristics are starts in the rectum. This is the characteristics of ulcerative colitis. We are talking about ulcers in your large intestines. Ulcers. And you know, this is the major part that destroys people. This one is the most common problem that disturbs people, and then you continually say you have ulcerations in your stomach. No, it is in the colon. So inflammation starts in the rectum. Disease spread continuously without skip lesions. So you will get, it is not ulcers that are skipping here and there. No, it is one ulcer that continues from your rectum where you pass your stool up to the colon. One big wound. You get it? But it affects only mucosal and submucosal are involved. This one says that it affects, let me use my hand like this. When I'm using my hand, take this hand as a layer of take this hand as a layer of the intestine. So between the dark part, the pigmented part, let's take the inner one here as the mucosal part, the inner part of my intestine. So this disease, it does not form perforation. It only affects the inner layer, this pigmented part. It forms a very big ulcer. Imagine this hand being a layer of the inner part of the intestine. So the pigmented part here, you will get from the rectum where you pass stool, you get a wound that has gone, has stretched, but it has not go in and form a perforation to this side. So it only affects it's a wound that only affects the inner part, but it does not go deep. That's why I'm saying it affects the mucosal part, the part that is, I'm imagining this as the inner part of the large intestine. So it affects the mucosal part and a bit of the submucosal. Let me draw this like this. So the submucosal part, let's take it before the pigmented part of my hand. So it does not go so deep. And you see, when this wound does not cross the submucosal part, they disturb the nerves and they are so painful. Causes ulcerations. Causes ulcerations. If you are watching and you are feeling that you are learning something, please have a like there. Let's have a like and share so that we can help other people to learn. Bleeding and mucus production, because mucus, why does mucus come? It's because there is a wound and food is there, and before food is digested for so long, before food is digested for so long, what happens? You start having mucus and even infections, because stale food that stays in your body for so long means septicemia. It means infections. You get it? Now, let's see. Uh, let's see the people and the part that this disease is more in between the age of 15 and 30 years. And of course, after your immunity starts going down at 50 to 70 years. You see, it's between 15 to 30. And after your immunity starts to go down when you are at 50 to 70 years. So that is where this more common in urban populations, more common in developing countries. Now, uh, people that have problems in their family, like irritable bowel syndromes, are the ones who are exposed to this. And sometimes environmental exposure and altered microbia in the gut. When you're taking things that can destroy your intestines to produce normal bacteria, you will be exposed to this. You see, so ulcerative colitis, as we say, this is a disease that is everywhere. It is not only in poor sanitation, just like irritable bowel syndrome, just like the irritable bowel syndrome. Guys, don't forget to share. Don't forget to share and give some likes so that we get more people to learn. There are some people that you cannot know the cause. Maybe it is genetic. It is genetic at times because some genes increase susceptibility to ulcerative colitis. Some people have genes that increases ulceration in the gut. You just have ulceration always in the gut. Family members at 2 to 8 times higher risk. You get it? Gene affecting epithelial bowel function. There is something called a gene that controls the epithelial layer in your gut that can cause it, doctor. Can you explain some of the things that can cause it? Yes, the causes, uncle, when it comes to ulcerative colitis, I'm explaining that the exact cause is unknown. There are some people, it's not like irritable bowel syndrome. Yes, Leila TV, I missed you so much. Hope you are doing okay. Welcome back, Leila. Welcome back to the platform. We are saying the exact cause of ulcerative colitis is unknown. The people that always complain that they have ulcerations, the exact cause is unknown. Why? Because after doing all the tests, you still find this person has nothing that is causing the wound, but this person is susceptible. So we end up saying gene affecting epithelial layer function, barrier function is at risk because of your genetic makeup. So we end up to say the causative agent of ulcerative colitis depends on your genetic makeup. You may find some people in their family. I have a bad sinus, but I'm fine. Miss you, Bo. Bad sinus. Leila TV has sinusitis and inflammation of the sinus. Leila, don't worry. I'm also undergoing the same and we will get better. Don't worry. Everything will be fine. Don't worry. Oh, I mean something that can you can eat. Oh, okay, uncle, I understand now. Something that you can eat and to increase or make you feel bad. We will discuss about nutrition. We are just going there, uncle. We are discuss about what to eat and what not to eat. Now, there is something called immune system dysfunction. Immune system dysfunction. The immune system dysfunction. Just a minute. I don't know why people are calling me, and there is something called immune system dysfunction, and I want to explain how. If you have a question, just ask please, so that we continue with we. Sorry. If you have a question, just ask so that we continue as we mark up. And please let's get connecting on online. There are some things we need to know. Hello, hi, you good? Oh, Samenda, mlienda. Oh, so give me time. I finish this session, then I call you back. I'm at bypass. Online. Um, uh, you. Oh, you'll drop by. Where are you at? Where are you at? Okay, you can take an Uber and come. Okay. Uh, Now we were talking about the sorry, we were continuing. Let's continue. Sorry about that call. Um, Sorry about that call, and we continue. This is where have we reached? We were at ulcerative colitis. Is believed. Yes, I was at the genetic maker about ulcerative colitis. There is something called ulcerative colitis is believed to involve abnormal immune response against intestinal microbacteria. Recognized normal gut bacteria. It recognizes, you have some bacteria in your gut that are help you. They are normal floras. They help you. But the problem is when the body looks at them as something that it can harm them, something that is not normal, you'll start having inflammation. So the gut bacteria in your colon, you see, the gut bacteria in your colon that is normal, helping you to create. I said there are some bacteria in your colon that help produce vitamins and some nutrients that help you. But the body mistakenly looks at them as bad things that can harm you. So they activate a process called the complementary system, immune system, to fight them. It activates the T cells and inflammatory cytokines to fight those bacteria. So they cause chronic inflammation. You start having chronic inflammation. Important cytokines like T necrotic factors, interleukin 1, interleukin 6, interleukin, those are things that help your body to fight infections. Now, they start fighting the bacteria that is helping you. You get it? These are things that happens in nature when you have ulcerative colitis. Now, environmental factors. Guys, let's interact. Have you ever had someone who has ulcerative colitis, or who a person who complains of ulcers every time? Tell me if you've ever heard of this person. Share to me and tell me how this person behaves. You get it? There are environmental factors that mostly affect mostly affect people with ulcerative colitis. Guys, don't just watch. I can see we are growing in number. Uh, have a like, and I have a number there that I've posted about a WhatsApp group that we interact and ask questions that are limited when it comes to online. That group will help us grow and help people. Even if you go to Jamaican's Uncle channel, you will find that number. So when you go to Jamaican's Uncle channel and you text, you are supposed to text from Jamaican Uncle. If you come from Benjamin the Wise Guy, text from Benjamin the Wise Guy so that you can be saved. But because if you just text, someone will not know where you came from. It's a limited WhatsApp number because we want to create a positive vibe community of helping each other grow. So please, if you are not in the WhatsApp group and you are willing to join it. Now we continue on environmental factors. Today, sorry guys, today I'm going so slow. My voice is down. The flu. I'm getting better and better. So we continue by saying this. Um, Environmental triggers may be infections, diet, antibiotics, pollution, and stress. And why antibiotics? When you take antibiotics, you are treating something in your body. What happens? You may treat, even kill the good bacteria that helps you. So when you kill even the good bacteria in your gut, you start forming ulcers because hydrochloric acid may go up and you form ulcers. Pollution, infections. You may get infections like H. pylori and you form some ulcers. You get it? So let's continue. There is something called microbiome alteration. I see the Mutua's world is still here. The Mutua's world is here. Uh, Thanks for being around. You can check the Mutua's world and 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 yes. Oh, yes. Naweza kupigia after 30 minutes tafadhali. Okay. Now you disrupt the intestinal immune tolerance and stimulate inflammatory pathway. Changes in gut bacterial dysbiosis. When you disrupt the normal, I said there are some bacteria in your gut. When you destroy them by your habits of eating, by taking a lot of alcohol, by taking a lot of antibiotics without precaution, you start stimulating inflammatory pathway. This means your body starts to fight back and you form ulcers in your rectum by altering the normal gut that is in your system. Yes, I know someone who always complain about it and she always say that she don't like to talk it anyone face because she's scared that her mouth smells. Oh, now uncle, when you this person is not suffering from ulcerative colitis. This one is suffering from something called Crohn's disease. Crohn's disease is another complication. Crohn's disease is another complication, just as ulcerative colitis, and we will see why the person smells up to the mouth. Smelling from the mouth is called halitosis. Halitosis. So, uncle, very well. This is a sister to ulcerative colitis, and she is suffering from Crohn's disease. Let's finish ulcerative colitis, then we will do Crohn's disease, then you will see why she is smelling even in the mouth. Halitosis. We will see. Thanks a lot for sharing that. That topic is coming. Mercy Grace has come. Welcome, Mercy Grace. And people, please, let's, and smelling from the foot, dog. That one is a fungus. Smelling from the foot is a fungus. and it is coming, we will see the complication of fungal infections in the foot, the Mutua's world, and they can be treated. The only problem is they are not treated correctly and the people give up. And sometimes fungal infection treatment is very expensive. Fungal infection treatment is very expensive and people tend to give up. So we will explain step to step. Guys that you are in this platform, please, as you watch me, support Mercy Grace. Let's help her. Let's go there. Let's camp there. Let's share the chicken with her. At least to smile. She's doing a very good job. Her content is fine. Let's support Mercy Grace. Okay, we continue. We the Mutua's world. That topic is coming. It's very important. You've mentioned it. And sorry, doc, but where is your clinic? I'm located on from town Thika Road. Thika Road. After KU, there is a bypass there, a place called Membli off Kiambu Road. That is where I'm located. You can always book an appointment. I have a secretary who books those appointments, or you can call me or you can text me so that we arrange when you can meet. The Mutua's world. Okay, now we continue in. Today I'm very slow. I'm very slow. So if you don't give us, make sure you are on the group list. Yes, Mercy Grace, come to the group list. We want to support everyone who is positive minded, please. Now we continue. We have said when you alter the bacteria in your gut that helps you to manufacture some vitamins, you are having. Hey, Leila, now don't kill me. You just said that intentionally because you know I love Pilau, Leila TV. And you've made me smile even if Margaret from Norway. You've made me smile even if I'm not feeling good. Thanks you a lot. Thanks you a lot. Now we continue. We continue with this. Let's see how you get the problem. Let's see how you get this problem slowly by slowly, so that when we will discuss Crohn's disease, the one that the friend of and also even one over here that is serious about eating some chicken. Yes, if you are here and you need to eat some chicken and get some increase in number, please tell us. I've seen some people are having so low numbers and I don't like it. Let's grow together, please. Help someone to grow. Yeah, it's true. Today is a Friday and I cook pilau is Friday. Finish your video call. Call you see. I will. Leila, please share your number on my platform. Leila, the number that I've placed there. Take it, Leila, and text there. I'll get your number, please. Okay, let's continue and tell people to like the video. Let's like this video. If you're learning something, please let's like this video. Let's like this video. Now we continue. We continue. This is how it goes. You take you take antibiotics. Your lifestyle of eating is habits is bad, fatty foods. Another thing, you are eating junk a lot, and then when you feel a little bit of a little bit, please check the link and you will see the number. Yes, the link, I've pinned it there. When you feel a headache a bit, you are in the pharmacy over the counter taking amoxicillin and taking a lot of antibiotics. What you are doing is you are destroying the gut flora, the bacteria. So when you destroy them, it destroys the intestinal barrier. This is my hand. I'm giving an example of I'm giving an example of the large intestine. This one is the large intestine. Here, the brighter part is the inside part. This one is the outside part. So in ulcerative colitis, you have destroyed the bacteria that help produce here some nutrients. This layer becomes damaged. And then the junctions become, when the upper layer that it protects inside damages, the junction becomes what? It becomes loose. And then bacteria penetrates inside because now you have an ulcer, you have a wound. Bacteria penetrates inside. So when the bacteria penetrates inside, this triggers immune activation. When you have a bacteria that is eating you, your body will respond with some cells coming out, like the macrophages that eat the strangers, the T helper cells, and neutrophils. And then there is something called tumor necrotic factor, those things that make you not to get cancer. Prostaglandins, they come out, leukotrienes come out, interleukins come out to fight for you. And this process is painful because something like when prostaglandins come out and tumor necrotic factor, it is painful. So it leads to it leads to an infection that is continuous with pain. Papa, but let me call you. Please. After 30 minutes, I'm in a session. It leads with pain. You get it? So this is how it starts. I hope every person has understood how it starts. It starts by you yourself taking alcohol, taking foods that are very fatty, and then they destroy the mucosal layer, and taking a lot of antibiotics that destroy the bacteria that help you in your colon. And more things we will see, we are continuing slowly by slowly. Now, when the inflammatory layer has been destroyed, what happens? The bacteria gets in, the bad bacteria, and then the inflammation starts to occur. So when the inflammation starts to occur, what happens? Pain, diarrhea, you bleeding from the ulcers. Now, ulcer formation comes in because now there is no chance for recovery. The mucosal layer erodes. The mucosal layer erodes. These ulcers bleed, mucus discharge comes in, and diarrhea goes on because now the layer that is supposed to absorb fluid is destroyed. Remember, we are talking about ulcerative colitis. Ulcers in your colon, colitis, the large intestines. You get it? And then after diarrhea, there is the fifth stage. This is the very bad stage. Because you have been having ulcers for so long. What happens? Uh, you form abscess. You form an abscess. An abscess is pus filled because of the ulcers. They start. It's a wound that starts to form. Can it be rebuilt back again, doctor? Yes, it can. It can be rebuilt, and we will see. Now you know foods and lifestyle can damage you, and also a lot of antibiotics. A lot of antibiotics. So don't be just taking antibiotics because you have a flu, or you just take antibiotics because you feel you are not feeling well. Be cautious and be with precaution when you are taking antibiotics. A lot of steroids, and a lot of painkillers that are NSAID. Those are non-steroidal like diclofenac and the other ones called brufens, aspirins, those ones. Leila Ali had H. pylori. Yes, Leila Ali, H. pylori is totally different from ulcerative colitis, although H. pylori can also give you serious ulcers. I think I'll repeat this topic on H. pylori so that people understand better. I'll repeat it. I've had several questions on H. pylori and I'll repeat it. So now you have formed an abscess. If you are coming in right now, like the video. Please like the video as we go on. Don't leave without liking. Just like the video as we go on. It is important we form uh, a group that we are worldwide and we are assisting each other. Now, When the cryptic abscess has formed, abscess is pus-filled pouches in your colon, we start having regeneration and pseudopolyps. Regeneration, mucosal islands. You feel there is bumps in your, when you've cut yourself, sometimes healing comes with bumps. If you look at somewhere maybe where you cut yourself a long time ago, you will find that there is a bump. That is what happens inside. Today I'm not using the software I use, but I'll show you in the next video. Now, those bumps, they are not part of they are not part of the large intestine. They are not. They don't do what the large intestine is supposed to be doing, like absorbing water, taking care of the gut. You get it. So it is a dead part, but it has regenerated. Now it is not having an ulcer again. Now, these are common in when you do a colonoscopy. We enter the, I don't know if I have a, sometimes I like talking while showing people how these things are. There is something called a colonoscopy that we enter in your, there, down there, this one. This one, as you see it, it goes down. You can manipulate it here. You can manipulate it here. As you look inside, this one is the camera. This one is the camera. This one. This one is the camera that goes in deep. And then you look at the, you look at the intestines. So China Marisimba is here. China, welcome. So when you are using this and you look at inside of your abdomen, you will see some bumpy areas, and they are called pseudopolyps. These bumpy areas don't do what your large intestine does. They are bad places that don't do. We have moved from now the ulcers, and now we have pseudopolyps after the abscess have formed. So we continue and say we can classify them like ulcerative proctitis only affect the rectum. You know the rectum where you pass stool, it can affect the rectum. And most of the symptom of proctitis, inflammation of your anus is called proctitis. So when you have a wound and you are getting inflammation there, just know that is proctitis, inflammation of the anus. And no, it is mostly because of proctitis. Mostly is because of ulcerative colitis, what we are discussing. It can cause rectal bleeding and urgency to pass stool, and you pass stool and you feel pain. The difference between this and IBS, this one as you pass stool, you feel pain. But IBS, after you've passed stool, you start feeling pain. No, now the second one is called proctosigmoidotitis. Involved rectum and the sigmoid colon. The rectum and the colon, just the sigmoid colon, when where it lies like this, it affects up to there. And then we have left-sided colitis. Extend to the splenic flexure. Above the spleen, it goes up to above the spleen. You see, it goes to above the spleen. And this one is, you will get bloody diarrhea because the ulcers healing above the spleen is slowly. They bleed and you get abdominal pain. You really get pain because above the spleen, you see, it is painful. We have another one called pancolitis. Pancolitis, pancolitis. If you are not understanding, please don't keep quiet. Just ask and we more dig deep and talk. Pancolitis, entire colon is affected. The entire colon is affected. So if you've been having ulcerations or you have gone to a doctor and the doctor has talked about ulcers, you have ulcerations, Herbs and Spice, welcome to the platform. What is cooking today, Herbs and Spice? Welcome to the platform. Let's talk about ulcerative colitis. Please visit Herbs and Spice also. There is a number there, please. If you need to be followed, there is a number there. Please join. And I've said, if you find it in Jamaica, you can write from Jamaican Uncle or from Benjamin the Wise Guy, and we will know you are part of us when you want to get to the group and you get more growth. Please get to that group. Let's grow together. Okay. Now, pancolitis, entire colon. Imagine the entire colon being affected with wounds. The entire colon being affected with wounds. We call it pancolitis. The first one, it was from the rectum. The second one, the first one was ulcerative proctitis. Proctitis, I've said, is inflammation of the anus. Proctitis, inflammation of the anus. Proctosigmoiditis, it involves the rectum and sigmoid colon. Then we have said left-sided colitis, which goes up to the splenic flexure. Splenic flexure is where the intestines and the spleen, there is something that is holding them. Please, if you are learning something, let's like and learn. You get it? Then pancolitis. Pancolitis is entire colon. Entire colon. Now, as we learn, what are the symptoms that can make you feel that I think I have ulcerative colitis? Most of the symptoms here, most of the symptoms are ulcerations. Most of the symptoms is bloody diarrhea. You diarrhea, but you feel that you have blood. You diarrhea, but you feel when you diarrheaing, you see blood. It is caused by ulcers and mucosal bleeding. That is the first symptom. The first symptom, bloody diarrhea. And then we have abdominal pain. Abdominal pain, usually located on the lower abdomen. You may feel it's a UTI because most of the time when people have UTIs, urinary tract infection, you will feel lower abdomen pain. The colon inflammation and bowel spasms cause pain. You see, that one is a very big sign. I can see Banana TV. Banana TV, welcome. Welcome to the house. We like your videos as you move around Nairobi and you show us how Nairobi is beautiful. I saw you somewhere that I visited some 30-something years ago. That is so long and it's so beautiful. It's called Uhuru Park. Continue doing the good work. Banana TV, there is a number there, join it. If you are coming as now, you can join that number. Now, we have said the lower abdomen causes spasms, and these spasms, they do what? They radiate. That's why you feel pain in the lower abdomen. And then there is tenesmus. Tenesmus, I said, is urgency to pass, incomplete bowel evacuation. You feel like going to the loo. You are going to the loo, but you feel that you have not emptied everything. You still want to be there. Feeling of incomplete bowel evacuation. When you go to the loo, you stay there feeling that I have not passed everything. You see, I have not passed everything, but you have passed everything. It is called tenesmus. So, Banana TV and those are coming here now. Please, your likes are vital. Your likes are vital. Banana TV, everyone who is reaching me out now, your likes are vital. Please like the video as you continue and share too. Share the information. Let's help someone out there. Let's make someone have some information and know what to do. Because I realize there are some people who go to hospital, they are so far from the hospital, and the getting information is hard. Even if they go to the doctor, sometimes they become confused. But when they view these videos slowly by slowly, they understand their problems and they take nutritional care. They take their they start working on themselves and they reduce hospital visiting. And that's what we usually want to do. Now, mucus in stool. This is because of damaged mucosal glands produced by excess mucus. Damaged mucosal glands produce excess mucus because you have ulcers, and those mucosal glands in your colon, in their colon, they start producing more mucus, and you know mucus helps you. Doctor says your likes are vital. Sawa daktari. Yes, because Leila, they are vital because if you have a channel and you like what I'm saying, it also increases your channel's impression. When now your YouTube is getting next to view, your channel comes. You know how YouTube works. They help. Likes help when you like, and you someone's channel, your channel is also given an impression. So that is why I'm saying it is vital. It helps people grow. Now, patients feel sudden need to defecate. Sometimes you feel a need to defecate. Suddenly, you just feel I want to go to the loo. Hmm? I'm talking about how these things happen, correct clinical features of this problem. One I've said is bloody diarrhea because of the ulcers, and abdominal pain because of the spasms. Colon inflammation causes spasms. So you get the lower abdomen problem. Tennis mass. I've said tennis mass. You feel you have not emptied everything in your stomach. Even if you go to the loo, you feel you have not emptied everything. And then mucus in stool. And we have learned that when there is ulcers, the tissue that produce mucus so that your bowel can be slippery, they start producing more mucus because they are damaged. They are not working correctly. Urgency. Patients feel sudden need to defecate sometimes. Fatigue caused by chronic inflammation and anemia. So, you know, when you are bleeding from the ulcers, you will have anemia. Why? They are not healing, and always you are going to the loo and passing blood. So you will be anemic. That's why you feel fatigued. When you are passing a lot of blood, you feel fatigued. Eh? Vital is a medic term. We are commoners. Vital is vital, listen to what Leila is saying. Vital is a medic term. We are commoners. Oh, sorry. Vital only says important. It is important. When I'm saying vital, I mean it's important. And so don't be. Medics terms are not complicated. They are just normal terms that are using some. Okay, we continue. Fatigue, and then we have something called weight loss. If you are having diarrhea, and seeing people are coming in, please Leila say have told me not to use vital. I say it's important. If you are coming in, it's important you like the video. It makes me smile and increases impression of my fellow YouTubers here. It makes them be famous. So like my video and let's share the. I sent something on your phone. Check it before you end. Okay, let me see. Uncle has sent something. Okay, let me link up with my phone. I see. Okay, so when you are diarrheaing and having those problems, what do? You will start having weight loss because you are losing a lot. You are losing water. You are losing. You are losing. Let me see. Please. Okay. Now, you see, There is someone I'm looking for. Yes, I've seen her. Okay, okay, okay. You see, when you are losing something, I'm doing something. Okay, that way. Now, when you are losing fluids and you are losing fluids and you are losing blood, you will lose weight. And when all this is happening, Jamaica, I don't know to Dr. Benjamin. Yes, welcome everyone. Let's love. Yes, yes, Banana TV, very important. I need those cakes and I need those cakes and subscriptions and even chicken soup. Yes. Now, so that we can help people to grow, we need numbers. This is, you know, there is something called a game of numbers. That is what we are doing. But in my platform, as we do the game of numbers, we are learning, and learning is interaction. Me interacting with you as a doctor and knowing how you do things when things go bad, and giving you some help and tips on how to help each other. So it is a what? Helping each other. Benjamin, what did Uncle send? Uncle was sending me a question. Uncle didn't want me to forget to address his question, so we have not finished, and I'm trying to address it. Good morning, everyone. Good morning, Dr. Benjamin. Really welcome to the platform. I feel nice when I see you here. The last time I was with you, I was in Nairobi. And it was a very good moment as we went around that night. Yes, now I know we will meet again, Ridley. Everyone check Ridley's profile and let's interact. Now, tenesmus, mucus in stool, urgency in passing, fatigue, weight loss, all those. Let me give again, let me go again to the features of ulcerative colitis. I'll just name because I've explained: bloody diarrhea, abdominal pain, tenesmus, mucus in stool, urgency, fatigue, weight loss, uh, all those are the problems when you have ulcers in your colon. Extraintestinal manifestations, because ulcerative colitis is an immune mediated disease, the other organs may be affected. Like what? You may get peripheral arthritis. Imagine you have problems in your colon and then you get arthritis. Sacroiliitis and ankylosing spondylitis. Ankylosing spondylitis is the problem of your back. Is the problem of your back. They start losing yes, uncle. Now you start answering yourself. Yesterday I made a fake but realized there was live was a replay. Yes, yes, yes. Yes, I saw them and I replied, thank you a lot for visiting again. Ankylosing spondylitis is a problem of your back. When you are losing your when you are losing your when you are losing electrolytes and nutrients in your body, what you get is like calcium. When calcium is down, what you get is your bone starts to be loose. And the normal curvature of your back is like this, and then it starts to shrink because calcium is not enough and you are not having it. Okay, you get it. Now, there is something that is very important, and I want you to note this. People that complain of, let me talk this very slowly. Let me talk about this very slowly. People that have problems of the stomach and the ulcerative colitis, they always take antacids, which is a very bad move. So after long taking of antacids, if you are just coming in, please, it's important to give a like as we continue. Question, Doc, what's the remedy for muscle contracting? remedy for muscle contracting is exercise. Exercise. That is, maybe you are saying muscle pull. Muscle pull is exercising and taking muscle relaxants. Yes, I was talking about an important point, and everyone should listen to this. People that have IBS, irritable bowel syndrome, ulcerative colitis, maybe H. pylori infection, these people always take antacids. A very bad move when you take antacids for so long. Why? It makes your bones brittle. Antacids, they are called proton pump inhibitors. And this one, they make your bones brittle. Blaze Masters, welcome, welcome. Please, please, not like as we go on. Please like the stream as we go. As you come in, let's give the likes. Let's grow the likes. Blaze Masters, welcome to the platform. We are talking about ulcerative colitis. I've said it is very important. Limit the use of proton pump inhibitors. These are antacids. If you have a problem that is for so long with your gut, with your belly, please don't use a lot of antacids. Why? Because you are roaring now. Roaring, I'm not understanding, Leila Ali. Please tell me why. Roaring, or my sound is bad. Is my sound bad, or I'm saying, Leila Ali, please make me understand. I've not understood your point. Let me repeat. When you have a problem with your gut, a problem with your gut, abdomen always, gas always, it is better to check your nutrition rather than taking a lot of antacids. My husband been taking antacid a lot, but his stomach is still acting up. Yes, Mary Simba, the most share this with your husband. If you have problems in your stomach, always check your nutrition. If it is irritable bowel syndrome, if it is ulcerative colitis, even if those diseases that you go to the lab and you don't find them positive, the most important part is to check your nutrition. Your nutrition is the most important thing when it comes to healing. When it comes to healing, because antacids have got its problem. Antacids have got its problem, and you see, those are the problems that come after a long use of these products. So let's interact, let's know the ways. Let's know the good ways we can use to do what? To help each other when you have irritable. And if you have not looked at the video of irritable bowel syndrome, please start with it. It was yesterday. Learn about it. Let's come to next. Let's talk about this one, ulcerative colitis. You have seen there is nowhere I've talked about antacids. There is nowhere that I've talked about give antacids, because they have their own effects here in these problems. So guys, it means that the stomach is making noise, Dr. Benjamin. Oh, okay. Okay. Okay, Doc, I will let him know. Thank you. Yes, Mary Simba, if you share this with him, mostly when you share it with the last video that we did last time, you will know how to handle these issues. Now, we were reaching at extra manifestation. extra manifestation, we have said peripheral arthritis, sacroiliitis, and ankylosing spondylitis. Those ones are the issues that can come. Spondylitis, ankylosing spondylitis affects your spinal cord. Peripheral arthritis is some fingers, bones, the normal bones of your. Welcome everyone to have you here. Feel free to interact. Yes, Banana TV, let people feel free to interact. Now, ulcerative colitis from your colon can affect your skin. You will get erythema nodosum, some nodules in your skin, pyodema, some you will see some lumps in your skin after a very long time. Eye disorders, you will see some eye uveitis in your uveitis, some reddish coloration in your eyes. Imagine you have problems in your colon, but they end up bringing some arthritis and problems in your eyes. Episcleritis. Liver disease, associated with primary sclerosing cholangitis. Complications when they come to liver, we will talk about that thing that I've named. Just know when you have problems with your gut and you're taking a lot of things that are not helping your gut, that problem can come. You remember we talked about something called toxic megacolon, a colon that becomes so big and you are passing so small fecal matter when you go to the loo because it is constricted. This one brings abdominal distension, fever, and shock. It needs now you'll be admitted. The colon, when it is complicated and it's not passing stool, it will stretch. You get it? It will stretch. Let's continue giving likes. I think Leila Ali has started feeling I'm being tough now. Leila Ali, I'm not being tough. I'm just advising. Please don't run away. I'm not feeling. I'm not being tough, Leila. It's because today I have a flu and the people are feeling like I'm being tough. So don't worry, Leila Ali. Don't worry. Come on, let's interact. Let's interact. Let's interact, Leila. Let's interact. Our stomach is like garbage. Can you really sometimes make me laugh? Our stomach is like garbage can. If we don't empty the trash, we end up having problems. Yes, we very true, Ridley. That is very true. You see, the topic of the day is ulcerative colitis, ulcers in your colon. But you see, we have ended up having arthritis, liver complications. Just imagine. And even taking omeprazoles, the antacid that people, I'm here learning and listening. Leila is a good friend to me. Wow. Okay, let's continue. Severe bleeding, you see, causing anemia. And also the last one, if you don't treat or take your nutritional care well, you will get cancer, colon rectal cancer, because of pancreatitis, long disease duration, and chronic inflammation. You end up getting cancer. And when you get cancer, treatment becomes problems because long wounds that are not healing can cause cancer. Long wounds that are not healing can cause cancer. Now, in what makes us know that you have ulcerative colitis, we do something called colonoscopy. I've shown you that this thing here, this thing that helps when we put it inside and then we see the ulcerations, and we find continuous inflammation of the colon, mucosal redness, erythema, redness, ulcers, and pseudopolyps. You see, when we find those pseudopolyps, you have said pseudopolyps are pouch of abscess that healed. We know you have not been having these ulcers for some time. It has been long. But most of the time we do biopsies to check the cells there, the cryptic abscesses so that we can eliminate cancer of the colon. Eh? Some tests we do like full hemogram to check your levels of if you have lost more blood, we check elevated CRP. CRP is checking the level of inflammation and something called erythrocyte sedimentation rate when it comes to infection. Those are things that we do in hospital. We can do some things like amoebiasis and cholera tests. Now, this is the time you need to ask me questions as we continue to finish. There are some drugs we give like corticosteroids to reduce prednisolone to reduce inflammation, and they help. But when you end up to have something like megacolon, what we do that is surgical, and then we give some immunosuppressant. We give you drugs that limit the cells that help your immunity to fight diseases so that they cannot continue making you get inflammation. You know, inflammation is painful. The interleukin 1, 2, and 3, plus tumor necrotic factor, and the other one, which is called the they come out, and then you feel pain when your body is trying to save yourself. You get it? We talked about interleukin 1. You've seen them. Let me find. Those are things that help when it comes to inflammation. You get it? So we give you some drugs that help you to reduce the inflammation. And those ones, you are given just for some time, not for so long. You are given for some time, not for so long. Now, if you have a question, please let's ask, because my time is ending. My time is ending now. Now, there is something called, and if you are willing to join the WhatsApp group, the number is there. If you visit Jamaican Uncle, the number is there. It will be pinned, and you just text from Jamaican Uncle, or from Benjamin the Wise Guy, or from Layla TV, or from J. King Ray. We know you are one of us. So then some foods give problems. Ridley is asking if some foods give problem. Yes, a lot of fatty foods, they will give problems. You should avoid triggers. Patients you check your lifestyle, prevention, and lifestyle management. Yeah? Benjamin, what can I give a 9-year-old with that type of flu? Also, sore throat. Okay, 9-year-old with a sore throat, you will give, let me write here. If you are not okay, ask Corinne. I'm answering. Please let me answer Mercy Grace. Ascoril 5 ml. You copy that text and go with it to a pharmacy, Mercy Grace. They'll give you what I want, because it will help a lot. Ascoril 5 ml BD 5/7, and then we'll give paracetamol. Paracetamol 500 BD 5/7, and you give amoxicillin 325 BD 5/7. And I'm trying to reply to our friend here. Yes, she has asked Mercy Grace and PDL 10, 5 milligrams, 5 milligrams, PD or D 5/7 at Mercy Grace. Mercy Grace, copy that text and go with it to a pharmacy. Get those drugs. The 9-year-old will be okay. That one heals better. But make sure the antibiotic, the sore throat maybe comes because of a bacterial infection. About the bloody stool and stains or mucus, one which of That is, Leila, that is all a call for attention. When you have bloody stool and stains and mucus, it means the goblet cells that produce mucus, they are destroyed and the ulcer is big. That's why you have the bloody stain. So that is call for attention. You really need to go to a hospital very quickly, and the hospital will do colonoscopy and they'll know what to help you with. Now, we have prevention and lifestyle management. Avoid trigger foods, maintain balanced diet, manage stress, avoid drugs like diclofenac. Leila, can I expound again? Or you see, Leila, when you get to bloody stool and mucus, that is an advanced stage. So you really need to be in hospital. That is call for attention. Attend regular colon cancer screening when you have these problems. That is lifestyle. You get it. And then we have important clinical measures when it comes to colorectal spread continuous affect only the mucosa. Now, those ones we will talk next. So we have talked today of it has been a good interactive session, and we have talked about we have talked about the we have talked about the ulcerative colitis. Tomorrow we will talk about another one called Crohn's disease. Tomorrow we will talk about Crohn's disease, and you will find like they look alike. But Uncle said there is someone who suffers from a similar disease but has bad breath on the mouth. So we will talk about Crohn's disease, and then we know why this person of Crohn's disease always have mouth with bad breath. So I think I've answered everyone, and the session has been welcoming. Let's continue supporting the channel and other channels. And the other thing is, if you don't understand anything, you are free to text. We have now a WhatsApp group where you can text and ask a question. And also, we have platforms like my email address. If you feel it is confidential, email me on my email address. Most of you have them. It is pinned on my videos so that we can continue growing. Thanks a lot for your likes. Thanks for your thanks for coming, for support as we interact. And have we said, if you feel you go to a channel of a sister and you find that it is having low numbers, please share the channel. Let the channel improve in numbers. We can get a certificate from your program learning about our body, Dr. Benjamin. Yes, we are organizing. I think Jamaican uncle will be in Kenya very soon. There is something I want to talk to him, and I've been talking to him. It will be an online certificate, that a program that will come just online, where you learn and you download the certificate. I'll talk to Jamaican uncle. We see how we can coordinate really, and even you, we will know about that. Thank you, Dr. Ben. Learned a lot today. Blessings. Thanks, Herbs and Spice. Thanks, Big Banana TV, and everyone who has tuned in. You see, I have a question. Mercy Grace asked if I'm ask before I leave, please. Ask before I leave. Can you talk about menopause? Menopause, yes, I will talk about menopause, but China Mary Simba, go to my playlist of mental health. You will see. Let me post it. Let me find it for China Mary Simba. I think China Mary Simba. There is a somewhere I talked about menopause. Let me get it for you. I want to get you the link of menopause so that you can read. You can we can, but we will still talk about it. Let me get that link of menopause, menopause playlist, and mental health. Not this one, not this one. Mhm. I'm getting that link for you. If you are just coming in right now, please like the video as we continue. Like the video as we continue. I'm getting a link for China Merisimba on something that is very important. Ammunition disorders, schizophrenia, and let me see, depression, this time, finding menopause. China, I am trying to find that video. I'll share with you, but just go to my platform and check on mental health playlist. You will find it there. Finding hypertensive management. I have so many videos, but I'll try to find it, and then you will go through. China Merisimba, please visit the platform on. There is a playlist called mental health. It has a video that I've talked on menopause, but menopause we will repeat it. Thank Boss One for putting my link. Please subscribe, everyone. Yes, the lifestyle. There is a number there that we have posted that you can link with others. You can text in. We add you in the group so that you can link with others, and we know how to grow. If you are getting it right now, start the video from the top. Don't fail to give me a like if you like my program. And there is one of us that have requested if we can get a certificate. Those plans are coming. It was Leila TV. That was a question. If I can talk about menopause, it is very important because it's part of life. I'll talk about it very soon. But there is a. Could you please talk about the hives more? Oh, the hives. What can bring the hives? I will. Yeah, the hives are reactions of histamines. Hives are reactions of histamines, and it is important. I'll talk about them. V. So tomorrow, B. I'll start with hives. You've really asked me to talk about hives. Tomorrow, when I start, because my time is out, I have 2 minutes. I need the awareness of the menopause too. So tomorrow, should we start with hives or menopause? Because tomorrow's topic is ulcerative colitis. Tomorrow's topic is ulcerative colitis. So what should we start with? Uh, let's see. But I can do today at 10 at night if I'll have some time. Let me talk about menopause because it's a request. And then tomorrow when I'm starting, I will start with hives. Then we go to the topic of the day. So today at around 10 at night, before I leave office, I'll talk about, it will be short, I'll talk about menopause. Today at 10 Kenyan time, 10 Kenyan time, we talk about Kenyan time, we talk about, yes, we talk about hives, we talk about menopause. Doing menopause. And then tomorrow at what time? Tomorrow when I'm starting the topic of the day tomorrow at 16. So if you find out what time it will be where you are at that time, I will start. with I will start with at 16. I will start with hives. Hives before the topic of the day. So blessings everyone. Let's maintain those who are interested on listening. Those um, so menopause is today, and hives is tomorrow. Tomorrow. So have a blessed day. Thanks all that have been in the platform. If you like joining the WhatsApp group for growth activation, that is. Bye bye. See you at 10 if I'll have some time so that we learn about menopause. It has been a request, and when you have been requested, I've seen 2 people have requested. So maintain the time. I'll be there to take you through menopause today at 10. Tomorrow we'll start with hives before the topic of the day. Bye. See you at that time.